Hello guys. So today we are going to cover some common presenting symptoms, okay, in gastrointestinal system. Okay guys. So in gastrointestinal system there are some common symptoms, that the type of symptoms the patient will uh, bring that symptoms to you, okay, while describing anything. Okay, so let's start with some symptoms. Okay, so firstly, okay, you need to start from mouth symptoms. Okay, so in mouth symptoms, you firstly what you will see is the patient is having bad breath. Okay, okay, the scientific term or the medical term, what we can say, the mouth symptoms, patient is having bad breath is halitosis. Halitosis. Okay, so it may be present due to gingivitis. Okay, the inflammation of your what do we say, like gums, inflammation of gums, it may occur. Okay, may occur due to gingivitis. Okay, and gingivitis is inflammation of gums. Okay guys, so this was the thing. Okay, so whether the patient is having any dental problem, okay, or any pharyngeal infection may be present on the patient. Okay, or while the patient might be having dry mouth. Okay, so dry mouth. So how do we say like patient is having dry mouth in our medical language? Okay, we will say that patient is having xerostomia. Okay, so these are just common things like bad breath. Patient is having bad breath due to gingivitis. Okay, gingivitis is the inflammation of gums, or the patient is having dry mouth. What do we say to dry mouth? To xerostomia. Okay, so also the patient sometimes say there's a altered taste sensation. Okay, so altered taste sensation. Okay, your patient will say to you that he's not been feeling any taste, not having any taste thing, like whenever he's having sugar or salt, he's not tasting like same. Okay, same before what he used to taste like. Okay, so we will say like the patient is having altered taste sensation, which we will define as dysgeusia. Dysgeusia. Okay, or the patient might say that the uh, taste sensation is like foul taste is present in the mouth. Okay, foul taste. Okay, without eating anything, foul taste may be present in the mouth. Okay, so what do we say, this foul taste in the mouth without eating anything or without any gingivitis or without anything, we will say cacogeusia. Cacogeusia. Okay, cacogeusia. So in mouth symptoms you need to learn limited things, okay, which I will mark it. Okay, first thing is bad breath, second thing is dry mouth, third thing is altered taste sensation, and the fourth one is foul taste in the mouth. Okay, these are the medical terminologies which you will use in while history taking. You will use this. Okay, and let's go to second one. Okay, the second one, what you will see is the patient is having any anorexia. Okay, anorexia or weight loss. Okay, weight loss will occur due to anorexia. Okay, so what is anorexia? Firstly, we need to define this. So anorexia we will define as a loss of appetite. Okay, or what we can say is a lack of interest in food. Okay. In addition, what we can say, uh, we are just asking about the appetite of the patient. Okay, whether the patient is enjoying his meal or not, and whether the patient is having any kind of fear that he might feel full. Okay, he might look like fatty person. So we can describe this as anorexia. Okay, so anorexia, okay, we completed. And in weight loss, what we will see is that the patient is having any kind of organic diseases, whether the patient is having any hyperthyroidism, by which is basal metabolic rate BMR is high, due to which the patient will lead into weight loss. Okay, so clinically, what do we say, that if there is a weight loss more than 3 kgs, okay, in last 6 months. Okay, okay, suppose a patient is having 3 kg weight loss, more than 3 kg, from the last 6 months. Okay, which is really significant. Okay, also the patient is not doing any physical exercises. Okay, physical exercise is not done by patient, and he was normal. Okay, completely normal, or suddenly his weight started dropping. Okay, losing, just patient is losing his weight continuously. Okay, so this is not the intentionally kind of weight loss. Okay, suppose there are two types of weight loss. We will define intentionally and non-intentionally. So intentionally we will define as, suppose the patient is a little bit fat, or he might be going to gym to make his body health. Okay, whether the patient is a bodybuilder, he's a regular gymmer. Okay, so this we can describe as intentionally. Okay, gym, going to have any exercise, going for exercises. Okay, okay, physical work, running. Okay, these are intentionally. Okay, non-intentionally we are going to describe like, suppose a patient is having any diseases. Okay, any cardiomyopathies. Okay, cardiomyopathies also, some things are there. Okay, some diseases are there by which the patient is losing his weight. Okay, also some type of esophageal varices kind of patient. Okay, esophageal varices. Okay, so we need to see whether the patient is losing his or her weight by some intentional method, or without doing anything, like non-intentionally. So the while the patient is losing his or her weight. Okay, so let's go to another one. So third one, this is pain. Okay, this pain thing I already explained you before, like Socrates. Okay, by this only you need to describe the pain of the patient. Okay, painful, painful thing. So okay, I already explained how to take a history. Okay, according to site onset character radiation, A stands for associated factors, and T for timing, and E stands for exacerbating factors, and relieving factors, and severity of the patient, like how much severe the pain is occurring. Okay, so in pain you will describe like patient, the patient will describe to you whether the patient is having painful mouth. Okay, painful mouth. Okay, or the patient is having any heartburn, or any reflux, sorry, or the patient is having dyspepsia. Okay, I will tell you each and everything. Just I will write all the symptoms, okay, in the pain. Okay, while the patient is having dyspepsia, or the patient might be having odynophagia. Okay, or the patient might be having abdominal pain. Okay, or there are too many things are there, but these are some important. Also, yes, one more thing, many things are there, like dysphagia. Okay, dysphagia the patient might be having, and in pain we'll say nausea and vomiting. Okay, guys, so these are just thick what do we say, pain symptoms. Okay, so these last two we are not going to consider in pain, because these are the separate symptoms. Okay, which we will discuss it after this thing. Okay, so in pain you will get the painful mouth. Okay, suppose the patient comes to you with painful mouth, what do we will see in the patient? Okay, the painful mouth may present due to sore lips. Okay, inflammation of the lips maybe occurred, maybe having due to some any food thing, like any spicy, or like patient is having any vasodilation, ligation of your veins. Okay, also the patient tongue is enlarged because of some internal factors. Okay, buccal mucosa. Okay, in buccal mucosa there are many types of ulcers which patient might be having. Okay, so there might be any deficiency. Okay, suppose in vitamin B complex deficiency, what the patient will have, the patient complains of mouth ulcers. Okay, so it might be having deficiency of vitamin B12 or C or folate, iron, or some more. Okay, there might be dermatological disorders. Okay, like there's one organism like lichen plantus. Okay, like it's a white kind of scary thing in the buccal mucosa. Okay, it might be painful mouth. It might be because of chemotherapy. Suppose the patient is having any type of cancer and the patient is going for his chemotherapy treatment. Okay, or painful mouth can occur due to some ulcers, like mouth ulcers. We already said about that, and also infective stomatitis. Okay, and there is some diseases like celiac diseases and inflammatory bowel diseases. Okay, what will happen in inflammatory bowel disease? That whole mucosa that will get inflamed. Okay, due to some internal what do we say, internal factors, like any kind of diseases. Celiac disease is a repulsive kind of disease, we can say like that, because whatever the patient eats, like gluten is the main celiac disease enemy. Okay, the patient will have that inflammatory bowel. Okay, because the patient is having their villi, and there are many different structures which will lie in the gut, which will not accept that gluten to absorb. Okay, due to this, what will happen, the hypersensitivity one will occur. Okay, then hypersensitivity one, we will say it is an anaphylactic shock. So due to this, the inflammation will occur, which we will say that it is inflammatory bowel disease. Okay, IBD. Okay, so secondly, I have completed this one. Secondly, in pain, the second symptom is heartburn and the reflux. Okay, heartburn, how the patient will describe to you. Okay, so heartburn, the patient will describe that the heartburn is a hot, burning, retrosternal discomfort. Okay, like burning sensation is coming. Okay, retrosternal discomfort. Okay, discomfort, like some pinch is there, like someone is just poking. Okay, poking in the epigastric region. The patient might say like this. Okay, so we need to differentiate, okay, whether the patient is having heartburn or the patient is having any type of cardiac chest pain. Okay, we need to ask some features to differentiate this thing. Okay, so in heartburn, what we will do is we will ask the patient like what type of pain is there, like which character. Okay, suppose the patient will say it's a burning sensation. Okay, burning. Okay, burning will get in hyperacidity reflex. Okay, when our stomach produces more amount of acid, it will result in hyper acidity. Okay, so also we will ask the patient at the radiation part whether the pain is going up or whether the pain is radiating to somewhere else, like in a heart diseases what will happen, the left hand and the left sided neck, lateral side of the neck, in the sternocleidomastoid and the trapezius side in the back, okay, posterior sided, the patient will feel pain. Okay, suppose if the patient is having cardiac diseases, okay, cardiac chest pain, so we need to differentiate these type, and also we need to see the precipitating factors. While lying flat, the patient is getting relieved, or bending forward, or lying down in supine position or prone position, like any position. Okay, so we need to ask the patient that what type of associated symptoms the patient is having. Okay, so it's a the first symptom we will ask is the patient is having water brash. Okay, so water brash is the water brash meaning is sudden appearance of fluid in the mouth due to reflex salivation, okay, which will result in the gastroesophageal reflux diseases. Okay, or rarely it might be present due to peptic ulcer diseases. Okay, water brash meaning. Okay, also we will ask in the associated symptoms, like the patient is having the taste of acid. Okay, or like acid, how we will define the acid, like some um, bad smelled taste. Okay, we will ask the patient like taste, like in his neck region, like some uh, acid went. Okay, like some irritation will be there in his pharynx. Okay, we will ask the patient like this. Okay, so in gastroesophageal reflux diseases, the heartburn and the chest pain, we will differentiate accordingly. Okay, so let's start for the third symptom of pain. So the third is dyspepsia. Okay, dyspepsia is pain. Okay, dyspepsia means pain, not like single organ pain. Okay, dyspepsia we can define as it's a pain or discomfort which is centered in the upper abdomen. Okay, how we will describe this? In contrast, what we can say, it's a indigestion is a term commonly used by the patient. Okay, for ill-defined symptom. Okay, and we need to ask our patient the site of pain. Okay, and the character of pain, and what are the exacerbating and the relieving factors. Okay, such as food and antacid, whether after the food the pain is relieved, or before the relief, after the food is relieved, or before the pain was not there. We need to ask some questions. Okay, like some particular questions are there. Okay, after that we will ask the patient associated symptoms. Okay, like associated with what. Okay, dyspepsia occurred. Okay, pain occurred due to what? Due to such as nausea. Associated with nausea, we will say. Associated with bloating is a gas filled inside our stomach, or what we can say, like edema. We can say like bloating is kind of edema of the tissues. Okay, or premature satiety. It means due to some internal organs physiologically, the patient will feel that his stomach is full without eating anything. Okay, due to some internally some organs enlargement, due to some obstruction, due to any inflammation, okay, of inner gastric mucosa or anything, the patient might feel like his stomach is full. Okay, So this is like dyspepsia we are going to see. Okay. Also there's two more left. Okay, the fourth one is odynophagia. Okay, in odynophagia is a pain while swallowing. Okay, so we'll describe odynophagia like what? The patient is having pain while swallowing. Okay, swallowing pain is not like we are it's not like the patient is having pharyngitis, laryngitis, we can say. Okay, tonsillitis, we can say. The patient is not having that thing. Okay, while patient is swallowing his food or drinking anything, the patient is having pain. Okay, it might be present anywhere. Okay, not in your larynx area, not in your pharynx area, not in your oropharynx area. It might be present in esophagus also. It might be present in your stomach also. ठीक है. So so it can be present with or without dysphagia. Okay, difficulty while swallowing. Okay, or it may indicate that esophageal ulceration may be present, or the patient is having esophagitis. Okay, from the gastroesophageal reflux. Okay, well, what it will say that it implies that the patient mucosal sensation is intact. Okay, and the patient might be having any discomfort due to some carcinoma. Any tumor might be present which is irritating that submucosal layer. Okay, esophageal mucosa or gastric mucosa. Okay, so we can describe odynophagia like that. Okay, and the fifth one is abdominal pain. Okay, in this abdominal pain, what I said to you before, in pain socrates, the patient will finger on which side the pain is occurring. Okay, the patient will say on the right flank the pain is there. Okay, so according to Socrates you need to describe the pain here. Okay, okay, mostly. Okay, in abdominal pain you need to describe pain by the help of Socrates. Okay, so abdominal pain is now over. Okay, now let's go for fourth one. I will put this one as a fourth. Okay, because these are mostly symptoms. Okay, these are just, this dysphagia is a symptom, nausea vomiting is a symptom. We cannot say it comes under the pain. Okay, so let's start with fourth one. What is the fourth one? Dysphagia. Okay, so dysphagia means difficulty in swallowing. Patient with dysphagia complains that the food or drink, whatever they are going to swallow, which it will stick while they swallow. Okay, so what do we ask to our patient? Like on set, we will ask like whether in the long standing process, while the patient is standing for so long, at that time the difficulty in swallowing is occurring, or recently, like any time while having food, anytime it may be occurring. Okay, so we'll ask the patient what type of nature is that, is intermittent or progressive, like day by day it's getting progressive, like before the patient used to swallow like easily, but soon after, day by day, after getting weeks and weeks and weeks, the patient is feeling more difficulty in swallowing. Okay, we will ask the patient. Okay, intermittent, we will say like patient is having patient swallowing good at very starting, whenever the patient is having food, and after some time, after finishing his food, the patient is feeling difficulty. Okay, we will ask the patient. Okay, so we'll also ask the patient what type of food he feels difficult, okay, to swallow. We will ask the patient swallowing solid food, liquid, or both. Okay, the patient will describe while eating solid thing it is occurring, while drinking any food, juices like water, any cola and all. So we will ask this. Okay, also in regurgitation we will ask. Okay, while the patient is swallowing any vibrations are present in his neck. Okay, any reflux of food is there, any fluid is coming out from his esophagus. Okay, so you'll ask this. Okay, so so this is about dysphagia. Okay, and the fifth one which we are going to study is a nausea and vomiting. Okay, so nausea is the sensation of feeling sick. Okay, also we can say nausea is a pre-vomiting kind of condition, like patient is not yet vomited but the patient is feeling like he's going to vomit. Okay, like sick type of feeling. Okay, so and the vomiting is the expulsion of the gastric content from our mouth via the mouth. Okay, so both the things like nausea and vomiting, we both are associated with pallor, sweating, and hyperventilation. Okay, these three things you need to remember. Okay, these nausea and vomiting. Suppose the patient is having nausea and vomiting. Okay, nausea plus vomiting. Okay, three things may be happening with the patient. It might be pallor. Okay, so it might be sweating, or the patient might be having hyperventilation. Hyperventilation. Okay, these three things. So what we need to ask to a patient is, we need to ask that in what relation to meals and timing the patient is getting nausea and vomiting. Okay, so we'll ask the patient like in early morning or in late evening, at what time the patient is having meal, and it is occurring in the morning time, or else it is occurring in the evening or afternoon or night time. Okay, we will ask the patient associated symptoms such as dyspepsia and abdominal pain. Okay, whether they are getting relieved by vomiting or not. Also, we will ask whether the vomiting is bile stained, because unconjugated bile yes, unconjugated bile stained color is green. Okay, or whether the patient is having blood stained or feculent. Okay, feculent means if any fecals or fecal like digested food is coming out of your mouth or not. Okay, so we will ask the patient associated weight loss, whether the patient is having any weight loss in recent past days. Okay, also we will ask the patient that you are having any medications or not. Okay, nausea and vomiting, particularly with abdominal pain or discomfort, suggests that the upper gastrointestinal disorders might be present. Okay, dyspepsia can cause nausea without vomiting. Okay, you need to remember this. Dyspepsia can cause nausea without vomiting. Okay, peptic ulcer seldom causes painless. When the peptic ulcer will cause painless vomiting. Okay, until and unless they are complicated with pyloric stenosis. Okay, whenever the stomach is present. Okay, this is esophagus. Okay, this is your stomach, this is lesser curvature, larger curvature. At this side the pyloric sphincter is present. Pyloric sphincter. Okay, suppose any pyloric stenosis is present. Okay, stenosis means narrowing of the tube, gut. Okay, we will say narrowing of the tube is called as stenosis. Okay, and the stenosis might be present in pylorus. We will say the stenosis present, so that's why the patient is vomiting. Okay, so this thing we can say happens in vomiting. Okay, and the fifth, this is the fifth one, and let's go for sixth symptom, abdominal distension. Okay, this is abdominal distension. So abdominal distension means the abdomen size. Okay, or else we can say abdominal girth slowly increases all over the months or years, or due to obesity, or due to any bloating, or due to any gas inside our bowel. We will define that the patient is having distension. Okay, it might be fat, okay, due to obesity, okay, or it might be due to ascites because the fluid in peritoneal space. Okay, it might be due to hepatomegaly, it might be due to splenomegaly, it might be due to inflammatory bowel diseases, it might be due to anything. Okay, see, the most common causes of the abdominal distension may be fat and obesity. I already told you. Okay, it may be flatters. Okay, it might be patient might be having any kind of obstruction. Okay, due to that, the patient might be having any distension. Faces and the subacute obstruction or constipation. Okay, suppose the patient is having obstruction in cecum. Okay, cecum is obstructed due to any actional factors like tumor might be present, or any stenosis is present due to some inflammatory pathology. Okay, so by that the patient is having distension obstruction. Due to that obstruction, the uh, whatever the patient is having and eating, it is accumulating in their intestine. Okay, or the patient is having ascites, okay, fluid, because it will accumulate in the peritoneal cavity. It might be because of tumor, okay, adrenal tumor may be present, okay, like an mesenteric tumor might be present, okay, anything. Okay, so it may be happen due to distended bladder also, because sometimes what happens is the bladder changes their position. Okay, from, suppose the patient is uh, gymmer or regular gymmer, it might happen in their old ages, the muscle relaxes. Okay, what will happen to bladder sometimes moves from its original position. Okay, it might be due to fetus in pregnant women, the abdominal distension is present. Okay, also the functional bloating might be present in the patient. Okay, so this is all about the abdominal distension. And the seventh one is present. Seventh one is altered bowel habit. Okay, altered bowel habit. In altered bowel habit, we will get diarrhea. Okay, diarrhea might be present in the patient. Okay, and second we will say constipation. Okay, in diarrhea, what you will see, we need to clarify to the patient that the patient, what do they mean by diarrhea. Firstly, what patient mean by diarrhea, we need to ask the patient. According to patient, listen the definition of the diarrhea. Okay, they may complain of frequent stool or change in consistency of the stool. Okay, normally frequency ranges from 3 bowel movement daily to once every 3 days. Okay, 3 bowel movements daily. Okay, normally according to our Macleod books, what we are going whatever we are studying, if the patient is having bowel movements, okay, 3 times a day. Okay, so it is normal. Okay, normally. And the diarrhea is the patient, where the patient is having more than 3 times in a day, we will describe that as a diarrhea. Diarrhea is the frequent passage of loose stool. Okay, steatorrhea is diarrheal associated with fat malabsorption. Okay, due to some obstruction in obstructive jaundice, when the bile is not coming into the duodenum, or the bile juices are not coming to our small intestine, the duodenum part, what will happen is emulsification of fat will not occur. Okay, whatever we are eating in our diet, some fat content is there. Okay, like oil and like lipids. Okay, these things are present, that malabsorption will be occurring. So what will happen is steatorrhea will be present. Okay, the meaning of steatorrhea is the stool is greasy, pale, bulky, and even they may float and making them difficult to flush. Okay, we will say that the steatorrhea is that type of diarrhea. Okay, So what we need to ask to our patient, that on which onset the diarrhea is occurring, okay, the whether the onset is acute, chronic, or intermittent, is coming and going on and off, like hourly basis the patient is doing having diarrhea, okay. So we'll ask the stool frequency, volume, color, consistency, and content. Okay, in frequency you will ask the patient that for within how many time you are getting stools, okay, we are going to washroom, okay. We'll ask the volume, like cup full of amount, okay, like 1 liter, like we need to ask the kgs, okay. So also we will ask the patient what type of what color was present, okay, in his faces. Also we will ask the patient consistency, that the it was solid, semi solid, unformed, or watery, okay. Also we will ask the patient what are the contents of his stool, whether the patient might be having red blood, any mucus is present, or pus is present, or melena is present, okay. We will ask mostly each and everything, okay, to our patient, okay. So this is according to diarrhea. And let's see constipation. So constipation, so firstly we need to ask the patient, so that what do you mean by constipation, okay, constipation. So we need to ask the patient, like what type of feeling is there, okay, like personally we need to ask, okay. So constipation is described as the infrequent passage of hard stools. So we need to ask the patient that on which onset the constipation is having, whether the patient is having constipation from lifelong, from starting only the patient is having this constipation, or in the recent onset, like recently this constipation started in our patient, okay. So we will ask the patient like stool frequency, okay, how often the patient moves their bowel, okay, each week, okay, and how much time is he spending straining at stool, okay. We will ask the patient the shape of the stool, for example pallet like, okay, pallet like may be present, okay, it like a sausage type, okay, it's like a soft one, okay, it's like a separate hard lumps is present, okay. We need to ask the patient each and everything, okay. So we need to ask the patient about drugs also, because there are some drugs which may cause which will decrease our peristaltic movement, and which will gradually result in constipation, okay. So constipation may be due to the lack of dietary fibers, okay, or it may be due to impaired colonic motility, like peristalsis movement in our intestine, or it might be due to mechanical intestinal obstruction, whether the obstruction is present due to tumor, okay, due to some obstruction, okay, due to stenosis, okay, like many things can happen, okay. Also we will see in our patient, like constipation is common in irritable bowel syndrome, okay. There are many other causes also, like colorectal cancers, okay, because of some cancer that cells tissues will enlarge, okay, which will result in obstruction, okay. Also it might be due to hypothyroidism, because in hypothyroidism your basal metabolic rate BMR will be decreased, okay. What will happen in if BMR is decreased, then your whole body will work slow, your peristalsis will be less, or motor activity will become less, okay. Your glycogen glyco genesis will be disturbed, like many things will happen, okay. So just a easy thing, okay. Now let's go for eighth symptom, it's bleeding. So in bleeding, so we will discuss from bleeding in next video, because I don't want my video to uh, like more than 1 hour. Okay, so thank you guys. Let's discuss this bleeding in our next class. Okay.